Durbin, Chief Executive Officer of Support Solutions. Welcome. I want you to enjoy a series of video trainings that we've developed to help you in your work here. As you know, we support nearly 500 people every day, and you are one of over 2,000 employees who are a vital part of that work. We've developed these trainings to assist you on the behavior side and on medical and nursing issues. We believe you'll find this information useful to you as you pursue your everyday performance, and welcome.
Hello, my name is Dee Dee Nelson, and I'm the Director of Nursing for Support Solutions. This is a medication refresher class that's to hopefully be able to get everybody on the same accord to give medications safely to our supported people. We'll have different presenters during the demonstrations to show you how the skills to properly give the medication, and also different people giving medications so that you can see how it can be correctly done in the homes. It is important, as we all know, to follow the 3 checks when giving our medications. You can see the 3 ways that we need to check our medicines prior to giving them to their supported people. It is also important to follow the rights before giving our medication, that it's to the right person, the right position, the right time, the right texture, the right route, the right dose, the right drug. And we know that our supported people also have the right to refuse, and we need to use right documentation when giving our medication.
My name is Vanessa Gratt. I am a registered nurse. The objective for the training today is to demonstrate the skilled practice that should be used in the home daily to ensure that supported persons receive their meds the same as the doctor has ordered the meds to be administered. The second objective is to make sure that when you administer the meds, that you read 3 times before the medicine reaches the person to prevent errors from being made. The third objective is to demonstrate, after the person has received the medication, that you do a final read to make sure that the meds were administered as ordered by the PCP, and to make sure that you record to the MAR that the med was administered correctly. When you first start out, you need to gather equipment. The necessary equipment: you should have gloves, you should have medicine cups, drinking cup, hand sanitizer. Make sure they have water in their cup. Any tissue that you need to clean the eyes or ears with for the procedure, as well, a pen to record, and a medication record. You need a supported person to make sure that before you start the process that they wash their hands at the sink with soap and water to prevent the spread of disease or germs, as well as yourself should do the same. Go to the sink and wash before you start the process. The next step should be go to the closet or wherever in the home your MAR and your supply is located to bring to the table wherever you're going to administer the meds at. Okay? When you open your MAR book, you want to find the MAR and look in the hour column on the MAR for the time of day that you're in the home administering the meds to the supported person. You read the MAR. It is 8 a.m. and then you go to the supply and you remove the container from the supply. You do your first read by matching the label to the MAR. The person's name, check Stephanie Smith on the label. On the bottom of the MAR, the person's name to ensure it's the right person's MAR and it's the right person's medication. Read the script, Colace, 100 milligrams, 2 tablets by mouth every day, and match it. You're matching the label to the MAR. That's the first read. You're going to proceed to give other meds at the same time. You go look at the next med on the MAR, remove the container from the supply. Read Stephanie Smith, Dilantin oral suspension, 125 milligrams per 5 milliliters, 10 milliliters by mouth every day at 8 a.m. Seizures, Dr. Allen House is the reason. Go to the next med in the supply. After you read the MAR, artificial tears, 2 drops in both eyes every day at 8 a.m. Once you have set up all the meds that has to be administered, you look at the meds according to the route. Oral meds are always administered first, okay? So you start a process of eliminating what you're going to start out with first to complete your second and third read before you administer the medication, okay? So I'm going to pick up the Colace first, and I'm going to do a second read. Colace, 100 milligrams, 2 tablets by mouth every day. And then I'm going to wash my hands before I proceed to remove the med from the container and apply my gloves. Then after I apply my gloves, I'm going to find the date of the month that I'm administering the medication, which is, today is the 7th, and I'm going to take the medicine cup and place it underneath the dose of medication that I'm going to remove from the container. So I remove 2 tablets into the cup. Then I proceed to do my third read. Colace, 100 milligrams. I have 2 tablets by mouth every day. Time is 8 a.m. When you're doing your 3 reads, remember you're being observant to the 7 rights. Do you have the right person? Is the person in the right position facing you? And you're facing the person as well in the right position. As I read, I observed the drug name. I observed the dose that I had to administer and the time that the med had to be administered and the route, the way the med had to be administered. Always remember, you're reading to be observant to the 7 rights to assure that there are no errors being made in the 7 rights. Now, I'm ready to administer the medication after I did my third read before it reached the supported person. As I give them the medicine, I observe for the swallow, and then I immediately remove my gloves and sanitize my hands. It is time now to record what I just administered. You read the MAR, which is the final read, come across from the time and the date that the med was administered, and write your initials on the MAR to record it immediately after the med was administered, then return the container to the supply. My next medication will be the Dilantin oral suspension. I'm going to read my second read. Dilantin oral suspension, 125 milligrams per 5 milliliters, 10 milliliters by mouth every day at 8 a.m. Seizures. Okay. So I need to shake this. It is a suspension. Some liquid meds you have to shake before you administer. When you remove your top, the tops are not clean. You never know where they've been last. So I take my top off. Remember, the top you want it to always place it against the table top, okay, without touching the inside, okay. Pick up my cup, find my measurement on the cup. My dose is 10 milliliters. When you pour liquid meds, make sure the label is in the palm of your hand. Always hold the cup eye level. To get the accurate measurement, never look down in the cup. Protect the label by placing it in the palm of your hands. Okay. Now I'm going to return my top, and I will wash and put my gloves on. I'll do my third read after the med is in the cup. Dilantin oral suspension, 125 milligrams, 5 milliliters. My dose is 10 milliliters by mouth every day, 8 a.m. She's in the right position. She is the right person. And I observe her swallow her medication. Remove my gloves, wash my hands. Final read, Dilantin oral suspension. I gave 10 milliliters. The route was by mouth, and the time I gave it was 8 a.m. I come across from the time on the MAR underneath the date that I administered the meds, and I sign the MAR. And I return the container to the supply. The last med to administer is the artificial tears. I proceed with my second read, artificial tears, 2 drops in both eyes every day at 8 a.m. Because I'm not placing it in the cup this time, I'm gonna go ahead and do my third read, artificial tears, 2 drops in both eyes every day at 8 a.m. Remove the container from the box. Take my top off. Lay my top to the side on the table. Proceed to wash my hands and apply my gloves. I'm going to clean the eyes first. The position for the head should be looking up, never look down. I'm cleaning the eyes so the eyes are closed. You're going to wipe from the inside out. Change your end of your washcloth and clean the other eye to prevent spread germs from one eye to the other eye. Ask the person to look up. Your thumb on the bottom, your forefinger on the top. Never give the eye drops in the person's field of vision. When they see your hands, they'll blink. So you want to get on the outside field of vision to the outer edge and drop and let them blink. Drop and let them blink. Okay? I'm going to turn the dial to the other side so my thumb will fall on the bottom and forefinger on the top, and hold the head back looking up and drop. Let them blink, drop, blink. Any excess, clean the eyes. Now I want to remove my gloves and sanitize according to the guidelines. When we use gloves, always wash before and after using your gloves. I'm going to replace my top now since I'm clean. Put my dropper back in the box, my container back in the box, and I'm going to do my final read. And I'm going to find the time, artificial tears, to make sure I record correctly and that I gave the med the same as the doctor ordered the med to be administered, and place my initials on the MAR. Once I've did my documentation, I'm returning the container to the supply. Now I must verify that my charting is done completely or correct by making sure on the back of the MAR I have my initials, my signature, and my title written legibly so that others can read it. That concludes the demonstration for eye and oral. This demonstration will include the administrations of the route for nasal, ear, inhalation, and patch topical use. Again, gather all necessary equipment. You will need tissue, hand sanitizer, and gloves for this procedure, and a pen to record the meds onto the MAR after you administer the medication. Remember, always wash your hands at the sink with soap and water, the supported person and yourself first before you start the procedure. Go to the closet or the location where the MAR book is at and the supply. Bring it to the designated area in the home that you will administer the meds. Open your MAR book. There should be a photograph on the front of the MAR book to identify your person to make sure that you're administering meds to the correct person. Open the MAR book. Look at your MAR. Look in the hour column on the MAR for the time of day that you're in the home administering the medication. Go to the supply, unlock it, and proceed to remove your containers from the supply. The first one, I'm going to administer eardrops. When I read the MAR, I will match the label with the MAR. Cortisporin. Her name is Stephanie Smith. Identify the name on the MAR and the label. Stephanie Smith, cortisporin, 2 drops right ear every day at 9 p.m. First read. The next med, nicotine patch. Go to the supply, remove, the container, match it to the MAR. Stephanie Smith nicotine patch. Apply 1 patch every day at 9 p.m. Tobacco use. Next Mid moisturizing nasal spray. I match it to the MAR. First read. 2 sprays each nostril at 9 p.m. Stephanie Smith nasal congestion. Last medication, Pulmicort inhaler. Stephanie Smith 200 micrograms, 1 inhalation every day at 9 p.m. Dr. House asthma. Now, as I look at all the meds that have to be administered at 9 p.m., I start the elimination process. Which one would I administer first and which one I will administer last? All these routes do not require food or water to administer, okay? So I will start with my eardrops first. Then I will proceed to my nasal spray, then my inhalation, and then my patch last, okay? So as I pick up my eardrops, I proceed to do my second read. Cortisporin, 2 drops, right ear every day at 9 p.m. And because I'm not going to place the medicine in a medicine cup for like oral, I will go ahead and do my third read. Cortisporin, 2 drops, right ear every day at 9 p.m. I will remove my container from the box, set it to the side. The tops are considered not clean, so I take my top off first before I wash with the sanitizer and apply my gloves. My supported person, put them in position. We want the right ear. So this would be her right ear. Good. This is the left one. Make sure I got the right ear, that's right. And I want to position the head to the side, horizontal. And you always want to pull for the adult ear, the ear up and back. Hold the ear up, take the drops and administer the drops. 1 drop, 2 drops. Put the container down and close the earlobe. For 1 ear, you will keep the head over 3 minutes. After 3 minutes up, I need to remove my gloves, wash my hands, and return my top. Now I'm ready to record. Put the metal container back in the box. Do my final read. Stephanie Smith, Cortisporin, 2 drops, right ear every day at 9 p.m. Come across for my time on the MAR underneath the correct date and initial. Return the container to the supply. My next medication would be the nasal spray. I proceed to do my second read. Moisturizing nasal spray, Stephanie Smith, 2 sprays each nostril at 9 p.m. Nasal congestion. Remove my top, lay my top to the side without contaminating it. Wash, put my gloves on. Close the nostril. Place the container at the tip of the nostril or nasal without touching the skin and spray and to inhale the air into the nasal passage, sniff. Close the other nostril. I got 2 sprays. I do another spray, same nostril, spray, sniff. Close the other nostril, spray, sniff, spray, sniff. Lay it down, the container down, remove my gloves, sanitize my hands. Now I can return the top without spreading body fluids. And I go ahead and do my final read. Moisturizing nasal spray, 2 sprays each nostril at 9 p.m. Come across from the time on the MAR up under the correct date. Initial the MAR. return the container to the supply. I'm ready to give my inhaler next, and I must do my second read. Pulmicort inhaler, Stephanie Smith. I'm giving 200 micrograms, 1 inhalation every day at 9 p.m. asthma. Go ahead and proceed to do my third read. Pulmicort inhaler, 200 micrograms, 1 inhalation every day at 9 p.m. Before I remove the top, because this already been in the mouth, I want to go ahead and wash my hands and apply my gloves and then remove my top. Make sure this is shaken prior to administering. It's an aerosol. And I want to place it inside the mouth and tell her to seal her lips around the mouthpiece tightly. On the count of 3, when I spray, I want you to inhale and hold. Hold for 10 seconds and then exhale through the nose. Slowly, I will demonstrate it. 1, 2, 3, spray. Clean the mouthpiece prior to returning the top while you got your gloves on. Okay. Always inspect the inside of the mouth for sores, as people can develop yeast infection from using inhalers. Keep these stored clean in the supply so people do not develop lung infection or any type of infection in the lungs. You can give them a little cup of water to rinse their mouth out after using the inhaler to prevent yeast buildup inside the mouth. Now, I need to do my final read. Pulmicort inhaler, 200 micrograms, 1 inhalation every day at 9. And I need to come across from the time underneath the correct date and initial the MAR that I observed them receive the medication. Return the container to the supply. My last med is the patch. Proceed with my second read. Stephanie Smith nicotine patch. Apply 1 patch every day at 9 p.m. My third read, since it's not going into the cup, is topical. Nicotine patch. Apply 1 patch every day at 9 p.m. Tobacco use. Remove my patch. Remember, always look for the patch where it was applied last. Before touching the doll, you want to make sure with the patch, you wash your hands. Remove the outer covering to the patch. Put the time on the patch that you're administering the meds and the date, month, date, and year. Apply the gloves. Remove the patch that was there previously. Rotate the site. Never put the patch in the same area because it irritates the skin. When you look on the back of your MAR, you have sites where you rotate the patch, and you use codes to document on the MAR where you applied the patch. So I'm going to clean the skin before I apply the patch. And I'm going to let it dry, and I'm going to apply the patch. Remove my gloves, wash my hands, do my final read. Nicotine patch. Apply 1 patch every day at 9 p.m. Find my time and come across from 9 p.m. Find the date and initial the MAR. Underneath my initials, I'm going to put the code for where I applied the patch. Right on. Code is RA. Come across from site underneath my initials and write RA for the site I applied the patch. Turn on the back to finalize my charting to make sure it's all correct and complete. Verify my initial, my signature, and my title one time for the whole month. Now I return the container to the supply. Secure the supply, return it to the location where I removed it from with the MAR. This demonstration will include rectal, vaginal, and topical use for skin. Again, gather all your necessary equipment that you need: gloves, hand sanitizer. You will need a sanitary napkin for vaginal use, a brief to put up on your supported person for rectal use, a pen to record your meds immediately after you administer the medication. Remember, always wash your hands to prevent the spread of disease and germs, as well as the supported person. Go to the location where the MAR and the supply is located. Remove, bring to the designated area in the home you're going to administer the meds. To provide privacy, we always want to administer rectal and vaginal in a room to provide privacy before administering the meds. Again, open your MAR book. Identify your patient to make sure it's the right person. Then remove your MAR and read. Look in the hour column for the time of day that you're in the home to administer the medication. Okay. And proceed to remove your containers from the supply. I will be administering to Stephanie Smith a saline enema, Fleet, 1 bottle rectally every 3 days at 8 p.m. First read. She will also receive a Monostat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Yeast infection. Topical use. Stephanie will receive hydrocortisone cream applied to rash on left wrist every day at 8 p.m. As I look at what I'm administering, I'll start the process of elimination. And I will administer the cream first. So I will proceed with my second read. Hydrocortisone cream applied to rash on left wrist at 8 p.m. Dermatitis. Third read, hydrocortisone cream applied to rash on left wrist every day at 8 p.m. Dermatitis. I'm going to remove my container from the box. Verify it's the right med in the box. And I'm going to flip my top. Proceed to wash my hands. Because my right hand is my dominant hand, it will be my dirty hand because that's my working hand. My left hand is my clean hand. So I always want to make sure whenever I pick the tube up, I pick it up with the clean hand. Never take my hands and cross. Never take clean and touch with dirty. You want to keep them separated during the procedure. Just demonstrate clean technique. Okay. So I got my gloves on and get my patient. And she's laying in the bed and we want her left wrist. Okay. She just has a rash on the left wrist. So you observe the location where you're going to apply the med. Before applying it, always make sure it's clean, skin look clean. And I'm going to go ahead and take the tube with my clean hand. Pick it up. You can apply the cream to the skin and rub it in, or you can apply it to a clean glove and rub it into the skin. When you apply the medicine, always from the center of the location of the area and rub in a circular motion out, away from the site. Never go back to the beginning in the center because you're going from clean back. You're going from dirty to clean. Okay, so in a circular motion, out, away. Okay, not a lot, just a small amount, enough to get it absorbed into the skin. When I get through, I'm going to set my tube down and I'm going to take my gloves off and wash my hands. Flip the top. Return it to the box. Final read. Hydrocortisone cream applied to rash on left wrist every day at 9 p.m. Find my time, come across on the correct date, initial. Return container to supply. Okay. While we're in the room, I'm going to go ahead and administer vaginal. So her name is Stephanie Smith. Check the label. And it's Monistat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Second read, Stephanie Smith, Monistat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Take my suppository from the box. Make sure I place my applicator on a clean surface. I got my sanitary pad. I need to prep the medication. Remove all your outer coverings, put it into the applicator. But before I do it, I'm going to check it again because I had to prep this dose of medicine myself to make sure I prepped it correctly according to the orders. Monistat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Take your hand and your thumb and your forefinger. Spread the labial lips apart. Tell the person to take a deep breath and insert the applicator into the vaginal tract as far as it'll go and push the plunger on the applicator in to release the medicine inside the vaginal area. Remove the applicator and dispose of it. Remember, while you have your gloves on, place your sanitary pad. Always instruct the supported person to stay down at least 10 to 30 minutes after administering vaginal medicine so it doesn't drain out the person's body. Remove your gloves, wash your hands. Final read. Monistat vaginal suppository. Insert 1 vaginally at 8 p.m. Go to the 7th. Cross from your time, initial the MAR. Return the container to the supply. Okay, while she's in the room, we're going to go ahead and administer the enema. And I do my second read, saline enema, Fleet, 1 bottle rectally every 3 days at 8 p.m. I'm going to go ahead and do my third read, Stephanie Smith, saline enema, 1 bottle rectally every 3 days at 8 p.m. And I can go ahead and take my top off. I'm going to leave it on because I want the water to get off. But I'm going to proceed to wash and put my gloves on. The position should be on the left side with the person's back facing you. I'm going to take my thumb and pull the upper cheek up to administer this medication so I can see the rectal opening. Tell her to take a deep breath. As I insert, I go in a slant toward the back wall. I take my thumb that's holding the upper skin of the buttock and press down to try to seal it because she's going to have an urge to push. So to try to get rid of some of that urge to push, as I'm squeezing, I'm telling her to hold. Don't push. Don't push. Okay? Don't push. If you see any draining out, that means she's pushing. So you're going to have to intervene and support the hold. Come out and push down. Don't leave it open because you push what you already administered out. Hold it for at least 10 minutes until you think the urge for the push has passed. Once the urge to push has passed, you can go ahead and close them up in the brief and let them know it'll be 2 to 5 minutes before you have an urge to push what's in out. So try to hold it as much as you can, but in 2 to 5 minutes, you're going to have an urge to push what's in out, okay? And I'm going to go ahead, since my label is on my container, I'm going to final read while I got my gloves on. Stephanie Smith saline enema, 1 bottle rectally every 3 days at 8 p.m. Dispose of the bottle because it's one use. Then I'm going to take my gloves off, wash my hands, and I'm going to read the MAR. Find the time I gave the med and the medication drug name and initial the MAR. Always check to make sure your charting is complete or done correctly at the end by assuring that your initial, your signature, and your title is on the back of the MAR one time for the entire month. That concludes my demonstration of all the routes for administering medications according to the skills safely to the supported persons in the home to make sure that we are not making errors. Always read before you administer medication. Thank you.
This next section is we're going to have a demonstration with a supported person and the DSP to be giving the medications to our supported people. I want you to watch the video to see what times you think if the meds are given correctly or if the meds are given incorrectly, and look to see what you think could be done better.
JD, my man, it's time for you to take that afternoon med. You ready? All right, great. I already know that this yours because your name right there, but I know you're supposed to take these pills anyway. Here you go. There you go, JD. Okay, JD, thanks for taking your med.
Peter, we're going to take our meds so we can head out into the community. Ready?
Leave me alone.
Peter, everything I do is for your benefit, okay? I want you to have your meds so we can continue to go out in the community and do fun stuff. Cool?
I tell you, leave me alone.
You want to take your meds so we can leave the
You
house?
gonna leave me alone after I take my med?
I absolutely will leave you alone. Okay. Some water.
Want no water? Leave me alone.
Okay, Peter. I'll just document and we'll just try another time, okay? Are you refusing to take your 4 o'clock med? Okay. You know, if you don't want to take your meds, you could have just said so earlier. You didn't have to wait until 4 o'clock. You know? Just think about what you're doing.
Hey, Peter.
Hi.
It's time for you to take your meds. Have you washed your hands at the sink with soap and water?
No, ma'am, I haven't.
Okay, you want to go wash your hands right quick?
No.
Well, let's use a little sanitizer then. Sanitize your hands.
No, I can use sanitizer.
Okay. All right, got your MAR. I'm gonna look at your MAR and see what medication you're gonna get at 4 o'clock. And you got blood pressure medication you gotta have. Okay. So, low pressure.
Do I gotta take that medicine? I don't like that medicine.
Well, you know, it's for your blood pressure, to stabilize your blood pressure so you don't have those headaches and lightheaded and dizzy.
Yes, ma'am.
Okay?
Yes, ma'am.
And make you not have those headaches all the time like you've been having. Okay, it should help.
Yes, ma'am.
Stop the headaches. Okay. All right. So I got low pressure, 50 milligrams, 2 tablets by mouth every day, 4 p.m. And check it again. Low pressure, 50 milligrams, 2 tablets by mouth every day at 4 p.m. Watch me put my gloves on and get me a medicine cup. And I'm looking for today's date. Punch. 2 tablets. Check it again. Low pressure, 50 milligrams, 2 tablets by mouth every day. Blood pressure, Peter Wright. Okay, Peter Wright. Alrighty. I'm gonna sit up straight. Need some water. All right, good. How you feeling?
I'm just gonna talk to them now.
Okay. Did you swallow it?
No.
No mouth. Okay. I don't see you. You swallow it. Okay. Take my gloves off. Wash my hands. Day, 4 p.m. Issue.
Now, can we go to the Skinner Center?
Sure, let's get ready to go.
All right.
Okay.
This next section is about the medication policy. Please read along, as you can see on the screen, of the medication policy. There will be a quiz at the end for you to review.
Today we're going to talk about policy number 55, the Arkansas Medication Management Policy. The purpose of our policy will be to provide staff instruction in assisting supported persons with medications as identified in our policy. The policy provides overall instruction to employees providing medication assistance to persons who are supported by Support Solutions. In the following paragraphs, you will notice that it shows the responsibility of each outlined important officers in our program. The Chief Executive Officer will ensure that all staff members of Support Solution receive training on the requirements of medication observation. We will provide resources and make opportunities available for training of all employees respective to medication use and assistance. The State Director, Regional Program Coordinators, and Home Manager will ensure that all staff members under his or her direct supervision have training respective to medication observation and use. Continuously monitor compliance of the policy and take necessary action if there is any evidence that employees are not following the policies and procedures respective to all medication-related policies. Report any medication-related issues to the Support Solutions Nurse Manager. The Support Solutions Nursing Department or designee will train all employees who are responsible for use of supported persons in the home on this policy and other medication use issues as needed. We will maintain current knowledge of medications and their use and guidelines and provide information to Support Solutions employees as necessary. Train or have designate trained employees as needed about the side effects of certain medications utilized by the supported person. Our procedures will be medication training. All direct support staff are required to receive training by the Director of Nursing or a designee in medication observation procedures to be qualified to observe supported persons during medication assistance. The Director of Nursing or designee must complete competency-based medication training for all direct support staff. All direct support staff must successfully complete the training before observing supported persons with medication. All supported persons are to be educated about their medicines. Our training shall include, but not be limited to, the following: instructions on the medication, including the use, purpose, and other important information like potential risk. Potential side effects of medication and monitoring supported persons for medication side effects and reporting. Proper procedures and techniques for monitoring and supervising the supported person's independence with self-administration. 7 rights of medication management, which include the right medicine, the right dose, the right route, the right time, the right documentation, the right person, and right position. Accurate documentation and recording on the medication observation record, including PRN, which is as needed, medication. Proper storage and disposal of your medication, reading of prescription labels and medication record, medication errors and strategies to prevent errors, actions and interventions to take when concerns regarding medications are identified. following physician orders, including timeliness of obtaining medications. Medication supervision is another important aspect. The Director of Nursing or designee will periodically monitor supported persons performing self-administration as well as direct support staff utilizing a medication observation checklist form. This shall be completed at least annually and more often as required. Direct support staff will consistently verify their knowledge and ability by receiving and reviewing updated written medication protocols. All signed and dated copies of protocols shall be kept in your employee file. Direct support staff will observe supported persons with assuring medications are taken timely. The time frame for observing with scheduled medications includes 30 minutes prior to or 30 minutes after the scheduled medication time. Direct support staff is responsible for ensuring medication compliance. However, direct support staff is required to document any refusals as well as proper notifications to the nurse or designee, behavior services, conservator, guardian, or primary care physician, referred to as the PCP, as applicable for refusals. Staff competency is to be tested and documented at least annually related to the supervision of self-administration of medication. Direct support staff will practice the 7 rights of medication during medication observation. Medication orders. All medications, whether prescription or over-the-counter, which may be referred to as OTC, need to be ordered by a treating practitioner, such as a dentist, doctor, physician's assistant, or nurse practitioner. All over-the-counter medications, including vitamin, herbal supplements, must be accompanied by a physician's order, documented on the medication record, and not contraindicated by allergies or sensitivities by the supported person. No medications will be administered or prescribed for punishment or convenience of support staff. All medication orders must be written on a practitioner order sheet or a prescription and signed by the treating practitioner. Medications identified on a medical office visit form must be highlighted and maintained in the supported person's record. Only licensed staff persons, such as a licensed practical nurse or a registered nurse, are allowed to take verbal telephone medication orders. Verbal telephone medication orders need to be signed by the treating practitioner within 72 business hours unless there are unusual circumstances existing, such as the practitioner is out of town. In cases of this nature, the nurse manager or designee will document attempts in supported person's record and obtain order as soon as possible. The direct support staff receiving medication orders while on medical appointments are required to inform their home manager of the new order immediately and no later than 2 hours after the appointment. The home manager or designee will fax a copy of the order to the pharmacy and the director of nursing or designee immediately and ensure medication is received within 24 hours. The home manager or designee will pick up medication and ensure proper documentation of the new order on the medication record and removal of any discontinued medications. The pharmacy and treating practitioner are available to answer questions about medications, side effects, and other information related to medications. The home manager will ensure that informational sheets accompanying medications are stored in the medication book. The home manager is responsible for ensuring the direct support staff review and sign the medication management plan and all medication side effect sheets. The Support Solutions case manager or designee is responsible for reviewing the medication record and ensuring that all physician orders are present in the record for all prescribed medications at least quarterly. The home manager and direct support staff are responsible for reviewing the medication record daily for errors when in the home and ensuring physician orders are present for all the medication. In the event a physician's order is received after hours or during weekends, the home manager will consult with the director of nursing or designee and ensure the order is filled at a local pharmacy within 24 hours of receiving the prescription. Our medication refills are handled as follows. Support Solutions will contract with a pharmacy company for proper dispensing of all medicines, including refills. Only the pharmacy will package and dispense the medication. The physician's office can provide sample medication when available, as long as the physician has labeled the samples with all the required information. The pharmacy will notify the physician's office when new medication orders for refills are needed. The home manager or direct support staff will notify the physician's office when refills need to be called into the pharmacy or written for staff to pick up. Appointments may be required by the treating practitioner for refills. Supported persons are to have continuity of care without a break in medications that are ordered routinely for daily use. If the supported person has an emergent need for a medication refill, he or she will be taken to the emergency room. Medication storage, prescription, and over-the-counter medications must be labeled appropriately and stored in a locked container or area which is designated strictly for the medication storage. Supplies and records relevant to medication management. Medications should be maintained under lock and key at all times for monitoring and to prevent unauthorized access or usage. The direct support staff trained in medication observation will have access to the locked storage area. The home manager and direct support staff will ensure that prescription medication is stored under each supported person's name, inside a plastic bag, bin, or containers. The home manager or direct support staff will ensure that all external and internal medications are stored separately, such as different container or in different Ziploc bags. All Schedule 2 through 7 medications, which will include narcotics, barbiturates, and controlled substances, must be double locked. Example, a lockbox within a locked cabinet or closet. Medications requiring refrigeration must be stored in a locked container in the refrigerator. This can be kept in the home refrigerator if placed in a proper locked container and should be kept separate from food items. The medication observation record, or MOR, is to be kept in the travel daily book and in the record with the practitioner's orders. Support Solutions Regional Program Coordinator will review medication processes, including proper storage, at least monthly during an announced or unannounced visit. Evidence of this form will be noted on the announced and unannounced visit form. The home manager or designee will review medications, including proper storage, at least weekly and daily when in the home. All PRN medications must have a treating practitioner order. Orders for PRN medications must have clearly written parameters to define the circumstances when the medication may be observed, specific symptom, the dosage and the frequency of administration, specific time frames, and any other special considerations. Over-the-counter medications do not require a pharmacy label as long as the order is consistent with the manufacturer directions. The person's name may be written on the bottle. The home manager or direct support staff members are required to review and ensure parameters listed for PRN medicines are defined on the medication record. An example would be Tylenol 325 milligrams every 4 hours as needed for temperature greater than 100.5 degrees. The home manager and direct support staff will ensure that usage of the medication is documented on the medication record, including its effectiveness. Medication side effects. The pharmacy or nursing designee generates side effect sheets that need to be kept with the medication observation record. The home manager and direct support staff are to review and become familiar with the side effect sheets and then educate the supported person with the appropriate information about the medication side effects. The home manager or direct support staff will ensure proper documentation of any observed side effects of medication and interventions. The home manager is responsible for contacting the PCP, the Director of Nursing or designee, for any side effects observed, as well as documenting side effects observed in the record. If treatment is indicated, the home manager or direct support staff will transport and follow up with the Director of Nursing or designee upon return. In an effort to monitor supported persons for potential side effects, the Director of Nursing or designee will address with PCP or other practitioners prescribing medication the routine need for laboratory tests and or a AIMS or TB screening. Support Solutions Service Coordinator is responsible for ensuring all information related to side effects or other critical health information is flagged and maintained in the supported person's record. Medication disposal. Medication must be destroyed when it is contaminated. Example of this would be dropping on the floor, it is refused, it is discontinued, an expired or label is not legible. To dispose of medication, 2 staff must be present to witness the disposal. To dispose of Schedule 2 through 7 medications, the staff will ensure all medication come to the office and be given to the nurse manager or designee for proper disposal according to federal guidelines. The office is to have a record of medication disposal records to be kept on file with 2 witnesses. The nurse will dispose of medications and complete the form. Medication refusals. Supported persons have the right to refuse their medication. Direct support staff are required to offer medications 3 times within the designated time frame to give medications. Direct support staff will inform the supported person of the consequences and risk associated with not taking scheduled medications. If the refusal of medications persists or is consistent, the supported person's conservator, legal representative, and behavior analyst should be notified to assist in providing intervention and additional training if needed. At no time will the missed dose be made up at the next scheduled medication dose time. The home manager or direct support staff should notify the nurse or designee if the supported person continues to refuse medications after 2 consecutive med passes. The nurse or designee will contact the treating practitioner regarding medication refusals. Medication documentation. blank spaces are not acceptable. If an ordered medication is not given for any reason, the medication block must be initialed and circled. The reason why it was not given must be recorded on the back of the MOR. Examples include omitted, refused, held, not available, and documentation error. Draw a line through blocks indicating the days that the medication is not to be administered, such as if the order is for every other day. The documentation of medication observation that is done out of the home should be documented using the following codes: P for program, V for visit or vacation, H for hospital. Medication reactions. The Support Solutions nurse or designee will review the records of the supported person for allergies. The chart and more are to have proper identification of allergies. In case of any reactions to medications resulting in life-threatening symptoms, the home manager or direct support staff will call 911 immediately. The nurse or designee is to be notified for observation of side effects or adverse reactions that occur with medications. The nurse or designee will notify the treating practitioner when there is an allergic reaction observed or other side effects that require further attention. The nurse or designee will follow a medical intervention as suggested by the treating practitioner up to and including contact with Poison Control Center or other outside emergency systems. Medication error reporting. Medication errors, omissions, are to be reported, managed, and tracked consistent with agency policy and procedure. In addition, when medication error and omissions occur, as identified below in the policy, a critical incident report must be completed and other entities as required by Support Solutions Incident Management Policy. The Director of Nursing or designee will receive medication error admission forms so the appropriate actions can be taken. The home manager or direct support staff will complete the medication error forms and submit to the Director of Nursing or designee. Medication errors may include, and not limited to, the wrong person receiving the medication, the wrong medication, the wrong dose, the wrong time, the wrong route, and missed, omitted dose. Direct support staff must report medication errors to the home manager and regional program coordinator, who will ensure that the form is completed and appropriate corrective action is taken. The form is then turned into the nursing department. Documentation errors, including an example like failure to initial the block on the MOR. If medication is found in an inappropriate place, such as a person's clothing, mixed with other meds, or in a package that is not legible, this is considered a med error. Medication errors are tracked and trended with a monthly report. Corrective actions, such as additional training, are to be taken to prevent similar medication variances when a trend is seen in the reporting. The supported person's record will only include a brief factual account of the medication error. Documentation should not state that an error was made, but only include what medication was given, the supported person's response, and any other staff intervention. On self-administration, the direct support staff may observe and supervise medication self-administration when a supported person is not fully independent or self-administration by adhering to the following. The direct support staff may remind a supported person of the time to take the medication. Direct support staff may read the supported person the medication regimen as indicated by the treating practitioner's order or commercially labeled container. Direct support staff may check the dosage that a supported person self-administers according to the treating practitioner's order or commercially labeled container, and he or she may be physically assisted in pouring the medication. Direct support staff will assist supported persons in ensuring medications are self-administered properly. The time frame for assisting with scheduled medications includes 30 minutes prior to or 30 minutes after the scheduled medication time. Documentation of controlled substances. All Schedule 2 through 7 are to be marked accordingly from the pharmacy so staff will know when a control count sheet needs to be used. All control medications are required to use narcotic control sheets with the MOR and counted at the end of every shift. The count must be done in the presence of 2 staff, preferably 1 staff from the off-going shift and 1 staff from the oncoming shift who are properly trained with meds. The count is verified to be correct to the doses given. Discrepancies in the drug count are be reported to the supervisor, agency administrator, nurse or designee for further directions. No staff is to leave the premises until the discrepancy is resolved by management with the proper actions. Proper storage and security of our medications during absences. There will be occasions when medications will be required to be administered by a parent, a family member, a guardian, or other individuals having close relationship with the supported persons during home visits or vacation. In addition, there will be occasions when direct support staff will observe the supported person during community outings, events, and medications will need to be administered. The following procedures will be followed to ensure safe and secure transport of medications. During home visits and vacations with family members and close friends, Support Solutions Home Manager will ensure that verbal and written instructions for the administration of the medications are provided to the family or close friend. Home Manager or Designee will review all medications and instructions with family or close friend and ensure understanding and clarity of any questions. A copy of medication observation record and properly labeled medications in bubble packs, sealed envelope will be provided to the family or close friend. Any medications requiring refrigeration will be placed in a plastic insulated cool bag for transport, and family will be instructed to ensure medications are refrigerated within 30 minutes. The home manager or designee will sign an acknowledgement along with the family or close friend verifying receipt of medications, instruction, and contact numbers for any questions and concerns. When returning medications to home, the family or close friend will return all medications that are not administered. All returned medications will be properly disposed of as noted in the policy. Some exceptions may apply for dated dial pack medications such as birth control pills. All missed medications will be documented on the MOR by the home manager or designee and in the supported person's daily shift notes. Home manager or designee will be responsible for contacting the regional program director and the director of nursing regarding missed medications. The director of nursing or designee will be responsible for contacting the primary care physician or other practitioner regarding missed medications and follow up any instruction given. When support staff is observing the supported person within the community, medications must be stored in locked medication box and the medication record must be present. If medication must be refrigerated, direct support staff will ensure that a cold, insulated bag is utilized to maintain temperature at required degrees. Direct support staff is responsible for ensuring a safe and comfortable environment to ensure all procedures for medication assistance are completed, including the signing of the MOR.
This concludes the section on the medication policy. Thank you. Here at Support Solutions, the nursing department appreciates all your time and effort that you spent today on this training video. If you have any questions, you are welcome to call your nurse at your office at any time. A nurse is available for you 24 hours a day, 7 days a week, weekend and holidays included. And I appreciate all your time and effort. For some offices, there is a quiz after watching the training video for you to complete. Thank you.